over the core, which is core stuff is huge. I just wait for it because honestly, core work is literally, I mean, a deadlift is core work, push-ups are core work. These exercises are specifically aimed at increasing the integrity of those muscles of the core. And speaking of, when we talk about the core, usually people just think about like abs, you know, vis-a-vis these exercises, right? So we have the normal crunch or a bicycle crunch, the GHD sit up, which is a massive, like hyperextended end range of motion spinal extension, and then also the Russian twist on the side. These exercises in and of themselves aren't necessarily inherently dangerous, but they can be precarious because we're not necessarily supposed to, quote unquote, train our core in this way. I'm not saying this way, but a lot of people almost exclusively train in this way, where it's like a lot of extension and flexion repeatedly, where we are either rotating the spine or we are flexing and extending. Um, and that's not necessarily the main purpose of those muscles. And before I get ahead of myself, I just wanted to express that when we are talking about core, it's really anything that connects to the axial spine. So we're talking anything that connects to the spine itself, but also our hips and also the scapulothoracic joint. So if we think of it in that way, you know, your glutes are your core, you know, your shoulder muscles, your pec muscles, those can be your core too. So it's really anything that is connected, you know, to the axial spine. So pretty much means like a lot of your muscles, like most of the muscles that are connected to your trunk are core musculature. Another way we can think about it is, you know, the muscles that need to be braced so that we can control movement along the fascial lines, where we have like our front line, our back line, lateral lines, spiral line, and functional line. So when we think about developing our core, it's bracing those lines so that the core can absorb and redistribute force. Um, but just like everything else, we also want to assess even when we're training core movements. With the core movement, when we're looking at the spine, there's really just two. There's extension and flexion. So the way that we can look at that, one, obviously, same as anything else, prior injuries, right? So with the core, when we're talking about somebody, you know, sciatic pain, disc issues, lumbar, um, or thoracic and cervical, those can all be issues, and even like the shoulders too. So if somebody has like a torn posterior cuff, it may make it hard to do some core movements where we have to incorporate our arms, like planks or chops. But if we're looking at actual functional assessments, so if we're looking at, this is the multi-segmental flexion. So this is to see if somebody has a flexion, is hesitant to flexion. So yes, you get that. Essentially what you do is just have somebody, knees are straight, and then they come hand over hand, and then they reach, and then you're trying to look at them fold through through the spine on this one. So without load, we're seeing, can somebody tolerate flexing all the segments of their spine, right? So you'll see a lot of people are okay with this one. They may be tight. One thing that you'll see, if somebody like can't get all the way down, if they're restricted, that's also a sign that you have to be careful with flexion-based exercises. But also if somebody has pain at any point in this, so if they go to reach down, they're like, you know, I feel that in my back, you know that they are flexion intolerant. So in other words, that's something that you'll have to work on slowly. If we go to the other side, and then we're looking at an extension assessment, which is multi-segmental extension. And so that's just the opposite. That's arms up, again, knees stay straight. And what you want to see is if somebody can, hips come forward, and you see this big global arc through the front side of the body. Again, without the knees bending. So again, the knees are bending forward. That's a compensation. If you see somebody, what you're looking for is, can this angle from the shoulder, kind of the base of the T-spine, be at 45 degrees about. But again, globally, right? So if somebody does this and they bend their knees and they're compensating, that's obviously a false test. And again, if there's pain anywhere through this, like for myself, because I have like old back injuries from sports, and I'm really extension biased, like this can cause me pain sometimes. So if you have somebody who comes in and you're assessing for the first time, you'll take them through both the flexion and extension bias, and they're like, you know, so you have somebody, I've got pain with flexion, and they've got pain with extension. So if they do both, that's a rare group, but that is some folks, and those are usually your deconditioned folks that work at a desk, right? So averse to most trunk brace movements. And then if you have somebody that has no pain with extension, so when they extend, there's no pain, but they flex forward, well, then you know that they have an extension bias. So doing things like, you know, your deadlifts and squats, that's probably gonna be okay with them, right? Because those are extension-based exercises. And then if you have somebody that comes through and they have no pain with flexion, so they can fold forward, touch your toes, and you see segmental spine movement, but they have pain with extension, then you can do things like bear crawls, a bench press to a certain extent. Usually step ups are okay. Things that put somebody in flexion are gonna be more tolerable. And then obviously if somebody has no pain with either one, then you're free to work any core training movements, and then even other movements outside the gym, like your squats and your deadlifts and your pulls and all that stuff. When we're looking a little deeper, so if we're looking at somebody, right, if they have pain with extension and pain with flexion, you're probably going to start with a lot of isometrics. Talking planks, side planks, static holds. Those are the things that are going to start to create enough tension in those fascial lines that they can create and redistribute force from the leg to the upper body without loading those segments in the spine itself, which is what we want. Now, same, we have somebody that has no pain with extension, so they can reach back. There's no pain, but there's pain with reaching forward. They can do some extension and some like lateral patterns, so like side to side, but you have to be careful doing any flexion-based movements. So you're going to start with isometrics like a plank and flexion, but then they can do things like underhand med ball throws or more dynamic extension-based core movements, right? Just you got to be careful with flexion. And then vice versa, somebody has no pain with flexion when they reach forward, there's no pain. They might have a little pain when they have extension, they reach back, which are usually people with like herniated discs. That's, you know, they'll squeeze back and that disc quartz and they'll compress a nerve. And then you're going to do things like, you know, your bear crawls are going to be okay. You can do things like push-ups, planks, those are going to be fine. But then you're going to have to be working things like a slow either holds and carries with like a kettlebells, like just a normal static like farmer's hold, or like a reverse plank, or like a GHD hold, something that's going to isometrically work extension so that they can build the tolerance in the posterior chain to load the spine. And then again, if they're fine with both, the cool thing about that is not only are they fine with flexion extension based isometrics, advanced isometrics and dynamic movements, but also lateral and rotational, they're good to go, which is a huge one. We'll talk about those. So if we're looking at somebody, if we're looking at flexion, right, or anti-extension, we're gonna, same as we did with like the deadlift and the squat, here's our progression. So isometric plank variations, so that's just, you know, normal just plank hold. I didn't put a video on there, but that can be everything from, you know, plank here, high plank, plank from the knees, all those are great. If you want to start to advance that without having to go to somebody to advanced isometrics, you can put them on like an unstable surface, like a Bosu ball that's like shaky. So that way it's a little bit more dynamic, but you're not necessarily having them move yet. Hollow variations. I'm gonna kick this one up just so you can see it real quick. A hollow is essentially just braced spinal flexion. So this is the first version. So it starts with the knees tucked and then one leg extended and the other leg extended. So now you're holding the entirety of the leg, and then the arms come overhead. And then that position right there, this is the hardest version of an isometric hollow. Now, when somebody's in this position, the low back is actually touching the ground and they're biasing flexion, right? So if you have somebody that is flexion intolerant, right? So with extension, they're fine, but flexion, they have pain. You're gonna have them start with this kind of knees in version first, right? And then you're gonna work up there 10, 20, 30, 45 seconds. They can have them start to do it, you know, with the legs out. Then you can have them start to do it with, you know, the arms overhead. And so that's just the hollow variations that you can start to progress that through. So we have planks, hollows, and then farmer holds. So our farmer hold, it's literally, it's a farmer's walk carry, but they're not moving this position. So both sides are loaded. the hips, the lateral line, the front line, all these are working together to keep this column, right? So it's just loaded under tension and trying to keep that column in a stacked position. It's like a deadlift hold. It's just holding at the top. And again, 10 seconds if somebody's starting to progress, right? And they're reverse deflection, they have to learn to brace the transverse abdominis and keep the erectors in that balance, and the hips stay under the rib cage. 10, 20 seconds, 30 seconds, work up to 45 seconds to a minute. And then once we have those hollows, those planks, and those farmer holds for about 45 to 60 seconds, and you've progressed them, then we can move to advanced isometrics. So this is where either our base of support is moving, or we're moving an object while we're holding these planks and these hollows. So shoulder taps is essentially just a plank, and as we hold the plank, it's just back is flat, knees are locked in extension, hips are in extension, and then you're just alternating where your base of support is, right side, left side, right side, left side. So then different muscles in the anterior line or different parts of the anterior line have to work to keep that plank position. So it's an advanced isometric. From there, another one that we can do, it's a little bit more difficult, is because we are incorporating the functional line and the posterior chain. So now we're holding the anterior chain tight while we are moving. This is not the right one. There we go. So plank position, and now we're incorporating the functional line, the posterior chain to do this pull down. So this is harder because now we're not alternating base of support, we're trying to hold the plank. And again, flat back, knees in extension. And now we're using the functional line here, right? The lats pulling and making that plank much harder. So when you pull down, right? So we have the posterior line, the functional line squeezing. So then to create a bracing position, the anterior line has to squeeze tight so that we don't come up and down. So that's a little bit more difficult than a plank shoulder tap. And then the hollow rock, let me see if it's the same video. Yeah, so there we go. So it's that hollow position. Now what the individual's doing is they are just kicking and extending. And so I tell people, I was like, your body's like a rocking chair now. Low back is still flat. And then they have to work on just, let me see if I can fast forward, kind of using this momentum, and then they transfer the momentum while they hold that isometric position. So again, it's still a hollow, right? It's still isometric, but now they're rocking, controlling motion while bracing the anterior line. And then we look towards things that are a little bit more aggressive, like the GHD sit-up, which I showed you in the beginning. And this I don't give to a lot of people just because it's an extreme end range of motion flexion, but I mean, all the way down, full extension and come up. This gal here is doing it like really like almost CrossFit style, where it's like rapid fire. This is why this is more of a dynamic movement. One, now we're moving kind of into that terminal extension and then coming to a little bit of flexion at the top. So one, it's a huge range of motion, and two, as you accelerate up, your anterior line's having to control a lot of bracing and weight as we're moving, right? So now we're looking at more dynamic movements. A normal sit-up falls in that category too. That's just like the upper range, is like the GHD sit-up with an added end range of motion. And then the last one before we go on to extension-based exercises would be something like, a ball slam. And that's just, the reason this is huge, right? Because we are rapidly going into flexion, right? So if somebody doesn't have the ability to flex, they may overload the posterior chain, they can hurt themselves. So this is more on the higher end of like a frontline flexion-based exercise. All right, so that covers those. Any questions on like the progression or where any of these fall? Like if you're trying to do these, or if you're trying to teach somebody these, like where you'd put an exercise in, or do you have any other exercise that you may have a question on?
Yeah, for the medicine ball slams, so you said that's for or flexion based bias, people will struggle with that. Would you recommend like an underhand tossing
Yeah,
it upwards?
so that's posterior line. So that's when we start going to, yeah. So if you're having somebody who's like, if they go into an extension and they're fine, like if they can extend and they're okay, but flexion, they're still not tolerant, you can have them progress to, the isometric holds, maybe do some shoulder taps. And then, yeah, you can do an underhand extension base though, which is like a granny toss, because then we're biasing extension with the throw, which is completely fine. So we can still go dynamic with an extension and then slowly build up our ability to brace flexion, right, through the front of the body. Uh, but that's assuming that somebody can, they go through an extension and there's no pain, and then flexion they have to slowly build up because there's a little bit of hesitancy or pain when they're flexing forward, right? So you would wait to do a ball slam with that individual until you know that they can really control, flexion and the front line muscles, so that they're not going to, jack the lower part of their spine rapidly into flexion and then hurt something.
Okay,
But yeah,
thanks.
good question. So that makes sense. There is kind of like what you can substitute there, because you can use both too. If we're talking about like a metabolic conditioning circuit, you could use a slam or an underhand throw. And say if you have somebody come through and you're trying to be like, all right, well, we only have a little bit of time. It's like, all right, well, maybe they've done their plank variations. Well, maybe they'll do, a set of, 10 shoulder taps or 10 each arm, pull downs, plank pull down. And then if you come and they superset, maybe they do an underhand like granny toss throw with a med ball. And you just go back and forth and you'll circuit train with that for like 5 minutes. Totally cool. So
Okay,
yeah,
thanks. And I
metabolic.
also had another question.
Yeah, yeah, go ahead.
So, your recommendations from, I think what I remember from lecture, uh, is you superset this with your like actual workout, like your main workout, like say squats, and then you do
Mhm.
these after, or would you use this as like a warm up
You can
before?
do both, right? So now if we're looking at somebody who is base level, this may be their entire workout, right? Or maybe maybe they're doing that med ball squat, like a goblet squat, right? And they're working, 3, 2, doing the eccentric loading. And then you'll have them come, because a squat is an extension based exercise. You want to work anti-extension, so then you can have them do like a plank variation. Right. Yeah. So usually you'll find that people who have some kind of intolerance with flexion or extension, you have to be careful with doing like full like squats and like deadlifts with them as well. So what you could do is, like, if this is somebody that's like a high level mover, you can have them do, maybe it's like, I do it with my groups. I think you saw them. They did, 10 each arm on their plank shoulder taps. We'll do like a single leg hold, and then we'll do that to get ready for their deadlift set. Or if I'm temping somebody through, and just again, because we want to make sure that we can resist anti-extension, because we're doing an extension-based exercise, so we're going to go through and do a plank, maybe like a plank hold or like a hollow rock or a plank pull down, and then they're going to deadlift, like we were talking about earlier when we were talking about squats and hinges, right? So yeah, that's on point, exactly. Cool.
Gotcha. Thank you.
And then that'll come into play when we're talking about these two, and we're talking about squatting. So posterior line bracing, so isometrics, reverse plank variations. So this is like the opposite of a normal plank, where our hands are in front of us. One of the first things you can do is you take an individual and you elevate them up on a box. And I would say, even before you go to the elbows on this variation right here, so see, now it's like a plank, except we're holding the backside of the body tight, right? So erectors, glutes, hamstrings. Um, Coming up from the hands is an easier variation of this, right? And then you can also go, so going down the elbows is harder. And something else you can do is you go on one leg, right? As a form of an advanced isometric. The other one, let me show you the other version that you can do, is you just go it all the way to the floor. So then again, we've taken the box away, move the individual further to the floor. This variation is from the hands, but again, if we want to make it tougher, we can go to the elbows, because the lower we go to the ground, the more our core is going to have to kick in to hold that posterior position. So that's just basically a reverse plank. All right. We can also bridge. Now, again, like I said in the beginning, the core muscles are anything that attaches to the axial spine. So the hamstrings and the glutes, those are core muscles, especially the glutes. So this right here, not necessarily rotation. So we're just looking at, hold on. So we're just looking at the bridge here. So it's up and hold, right? Way you can make that tougher too is you put a band around the knees, so there's really more activation of external rotation from the glutes. And can somebody hold this position, right? 10, 30, 45, 60 seconds. Super simple. And then the farmer hold again, because the farmer hold is a full structural exercise. So if somebody comes up and they have 2 kettlebells or 2 dumbbells and they're just holding it right here just for time, you'll work the posterior and the anterior chain. And then advanced isometrics. Now look at the reverse plank, so that hold position. Now we're having the person, just like shoulder taps, alternate the leg position. So up and then alternate sides, trying to keep an eye on the hips, and can that individual, right, keep this level. And again, if you go from the hands, it's probably easier, and if you go from a box, it's easier. So you go from a box on your hands to your elbows to the ground on your hands and then your elbows, and you're just alternating right and left, um, legs kicking up like this. And can they maintain that hip position and really activate the back line? But now you're looking, you know, reciprocally, can the right leg, right leg, left leg kick into the glutes and then into the low back and the posterior chain to control the isometric position. All right. Bridge march, the same idea. We're just coming to that bridge like we saw in the first video, except now the individual comes up and then they one leg at a time. So again, you're looking at the trunk, you're looking at the hips. Is this staying steady, right? And can the individual kind of keep everything in place while the legs are the only thing moving? So huge activator for the especially the glutes, the lower posterior chain on that one. And then I think our last one was, a farmer walk. So a farmer's walk, I have it later on, but a farmer walk. So now you have the weights in both hands, dumbbells, kettlebells, a trap bar or something, and now the individual's moving and they're trying to maintain that structure, right? That tall position without leaning side to side or coming forward and back while they're holding weights. So now you're walking after that isometric hold that we did, just for the initial isometric kind of basics. And then we can go to dynamics. We're looking at dynamic. So we're looking at like ballistic. I'll just show you with one. And then, yeah, a normal swing, two hands, obviously, and then you'd go to one as far as advancing the position. But this is essentially just, this is extension, and now it's just dynamic, right? And then it's under load. So once anybody can control marching, they can control, the planks, then you'd go to something like a single or like a kettlebell swing, kind of the opposite of a ball slam, which is an extension-based med ball plyometric. So he's doing it straight up. You could do it into a wall, right? But essentially now, rather than throwing the ball down, we're working on it coming into extension either up, or you could throw it forward at a wall like this. Both of those are fine. Cool. So that's kind of a progression for extension anti-flexion exercise. One side's obviously, your setup crunch kind of stuff, planks, and the other side's, reverse plank, anything that has to do with extension. The kind of the point I'm going to drive home when we talk about lateral flexion and rotation, right? It all follows the same pattern: isometric, advanced isometric, and then dynamic when we're draining the core. So you want to make sure someone control the position in place first, then you start to add perturbation, and then you can actually add dynamic explosive movement under load. Okay. Lateral line bracing, right? So this is like your side planks. So right there, our first one, if we're going through isometrics, basic side plank. I like this exercise specifically for scapulothoracic rhythm, for holding that position. There is not as much lateral line bracing, which is fine, but that's why it makes it like a good remedial progression to like the side plank from the hand or from the elbow, which is like this one. So then we go, and then it's just, again, just like the reverse plank, the regular plank, the lower we are to the ground, the more we're going to load the musculature of the core and less of the shoulders. So we can use those progressions, pal off. And so right there, just holding that sucker right there. So now the band is coming from the side. So now he's resisting actually anti-rotation, a little bit of lateral flexion. And then so we're just holding that right there. Same thing, 10 seconds, 20 seconds, 30 seconds, building up to about like a 45, 60-second position. If somebody's like has issues with any kind of rotation, then you want to make sure that they can build through here, because now when we're talking about rotation and anti-lateral flexion exercises, now we're starting to incorporate, we talked about this with fascial lines, right? The functional and the spiral lines, which means that your lat and your obliques, external obliques, have to pair with the opposite glute. So it's different than just like front line and back line where everything's all in a row. We're talking about anti-flexion, anti-lateral rotation. Now we're talking about muscles that are working on the opposite side of the body. So you have somebody that like isn't a good mover, or like an injured athlete, you have to start to incorporate those muscles in that fascial line to reestablish that movement pattern. So hence, we work to hold on this first. And then we go, oh, single arm hold variations. So that's, like the farmer's walk we did, except you just hold one side. So this is like an advanced version of a plank, essentially. Have someone come tall. And then now we're just working on a lot more lateral flexion and more of a kind of like tall position, which, like, if we're talking about athletes or even like an individual who just works, a desk job, they're carrying like a briefcase, or even people carrying groceries will usually do it on one side. So that's huge to be able to brace, the contralateral side if we're holding a load on the right side and being able to brace on the left. And then cool. So side plank variations from the elbow and the hand. Then we have our paddle off, which is just that hold, and then we have the single arm hold variations, like the farmer's hold just with one hand. And then advanced isometrics. So again, this is just like the regular plank, where once we're coming in and we're holding, then we can start to add other variations. Like this one, I think, is the row. So individuals in a plank, and just like the regular pull-up, now that individual is doing a row with it. So stable base, top arm is having to squeeze. And if we're talking about functional lines, then we have this lat on the left side having to contralaterally activate with the right glute, which is holding us and resisting lateral flexion. So it's an advanced isometric. Let me see if I can just get this full speed for you. Yeah, so see now, arms moving, stable base of support with the right side. And then, oh, leg raise. So this one's kind of cool too. This is the knee variation first. So here we are, we're side plank. And then that top leg's gonna move up and down, so I can use it for support, and then all of a sudden, boom, it comes up. This is a more advanced version, so I'm here. So that top leg can help for a second, and then we have to go top leg helps, and then boom, just one leg. Top leg helps, and then boom, down to one leg. So we're just adding a little bit of bracing, and all of a sudden we move that top leg, and it can't help the bottom leg brace, and then boom, there's an increase in intensity, and then we drop back down. So again, just keeping with that theme of an advanced isometric on the bottom leg while the top leg is moving. Paddle off press, and so we have that sideways position, we extend, and then we raise overhead. So when we go out in front this way, it's actually an anti-rotation exercise. Still fine, a lot of the same muscles. As soon as we come overhead there, a lot of internal oblique work trying to keep that sucker from leaning to the side. So this is a really good core movement. Like, I'll get people who are like athletes or who have like six packs, and I'll give them to this, and they're falling all over the place because they can't integrate it. They don't know how. So this is a huge exercise to incorporate those functional lateral lines and the functional line and the spiral line from like a movement standpoint. And again, just advanced isometrics. And same thing. So single arm carry. So rather than just a single arm hold, now we're carrying with it. There we go. So right there, right? One key thing with this, obviously he's moving, changing base of support from right to left, right, as he's carrying. Left side, the external obliques and the glute are really doing a lot of work to stabilize. Keys here, don't let the dumbbell hang, right? So we want to incorporate that lat, right? Squeezing down into the functional line of the opposite glute. And then the other thing we can do too, to make this even more advanced, is go to a march. So he starts picking his knees up, and then we're spending more time on one leg. And as we go into hip flexion and we activate the spiral line on the front side, just like how the posterior line and the anterior line have to work to stabilize the pelvis front and back, spiral line and the functional line have to stabilize rotation right and left. So then if we go to high knees, it makes the carry a more difficult variation, but still isometric as far as like the core is concerned. And then we can go to things like a plank drop, plank rotation. So we're in the plank here. So we're bracing through the front line, and then we're using the lateral line to actually move us now, right? So it's still a plank's isometric exercise. However, now we're actually using those lateral line muscles, right? The external obliques, internal obliques, and the glute med to lift up and down in the hips. And then plank rotations. Right, so now, boom, base of support. Now we're using our spiral line to pull into the lateral line. We brace the lateral line, and then we come back up, and we extend using the functional line. That's the same side that's holding us up. So just, again, a more advanced version of the side plank variation, right? Side dynamic version. Pal off rotations. So now we're looking at get this fast forward. So now we hold here in the base of support, and what we're doing is we press and then we rotate out. Right. So now we're actually using well some of the spiral line or the functional lines here to actually rotate the band in and out. So now we're turning, right, as opposed to just holding or raising it overhead. So rather than just holding those muscles tight, right, they're actually being used to turn the band, right? So dynamic, just like we did with the extension and the flexion throws, right? So we went to ball slams and then underhand ball throws. Now we're starting to actually move. In fact, there they are again, more med ball movements. So again, now we're using the core musculature to actually turn us and then throw something laterally. So again, fully open chain, more dynamic, end range as far as getting somebody to the position where we're actually using lateral bracing strategies. And remember with this one and with anti-rotation, I like pairing these up with the squat just because again, when we're looking at, if we look at this shot here on the right, this picture on the right, lateral lines come from, right, there's the external obliques or the internal obliques, connects right to the TFL and glute med, down to the IT band, right to the peroneals. All this has to be braced equally with the contralateral side so that we can squat without loading one hip or one knee more than the other. That's why I like loading this with squatting patterns, lateral flexion exercises. All right, and then our last one, rotation and anti-rotation. So now we're looking at these big functional chains, right? Exclusively kind of the ones that help us, run, right? Left knee up, right arm shoot when we're running. Baseball player, right? Push off the right side, swing to the left, right? Or throwing a ball, same thing, push off your right. Finish by stepping forward with the left side. A whole bunch of different kind of more dynamic movements if we're looking, even if just general movers, right? People who run and jog and things like that. So anyways, we're looking at isometrics, same kind of progression, isos and then advanced and then dynamic. All right. So from here, when we're in this kind of kneeling position, what's happened now is with this foot on the ground, it's this glute is having to dig in. So push through that toe, that glute's activated, and the lats on the opposite side are having to squeeze. So now we're using the functional line to hold here, right? So similar to the peel off that I was showing with Aaron's video when he was on his feet, when we go down to the knee, there's a lot more activation with that hip, right? So we've taken the individual lower to the ground. We've also activated the glutes more by putting this knee in flexion and then putting that ankle in flexion as well into plantar flexion. And so that glute's going to fire and we can activate it more as we hold with the lats. So we're looking at the functional line there. A quadruped hold. So that's more of a crawl. The quadruped hold you can use, I would say, more for a frontline bracing technique like a plank, right? So somebody who can tolerate flexion-based exercises. This becomes a lot more rotational, anti-rotational when we start working in with the crawls. So that's why we have our crawl position, our quadruped hold position as a basic isometric for doing functional line rotation, anti-rotation exercises. And then a dead bug. Not sure if you've seen this one. And again, this is another one that's not necessarily mutually exclusive, just a functional line exercise or a spiral line exercise. This is still a big frontline exercise. So here it's kind of like that hollow. I don't necessarily like these individuals where the arms and legs are going to come up. You're going to hold spinal flexion. And then, so what we're going to spines here and what we do from that position, let me just go show you right to the next ones, is alternating dead bug. And then this is where we really start to create that, that spiral line activation. So see how he's holding here? So now as we reciprocate right, left, this spiral line's more activated. This one's at length. This one's activated. This one's at length. So now we're starting to use those kind of hip flexors, the external or the internal obliques. We're starting to work the pec minor, pec major as a form of core musculature just to hold that position and articulate the arms and the legs around a stable core. All right, and then the same thing with the stationary crawls. So that's just like kind of like a bear crawl. I'm not sure if we ever did that when you were able to shadow groups. That's just See, kind of the same thing. It's just placed down towards the floor. Right arm, left leg, left arm, right leg, right? So we lift up, we lift, boom, spiral line, squeeze, hip flexor, squeeze, pec squeeze, back down, hip flexor, squeeze, pec squeeze. So now we're working through that spiral line, again, isometrically. And then where's the one that I missed? Oh, a chop. So a chop here, it's the same position, it's a split stance. And now what we're doing is the same thing that we did like with the pal off, where we rotated. It's just the reason this is, I'd say that's a little bit much, but you can have this be isometric by just moving the arms. I would almost consider in this video a dynamic one. See how the shoulders are turning a little bit? So when the shoulders start to turn, then it becomes a dynamic exercise because now we're starting to create spinal rotation, which is fine because we're actually moving the spine now. It's
That
not a
makes sense.
stable spine, stable core, while the arms move around it. All right. Speaking of, here we go. This one better be more dynamic if I have it my chop and twist. So for late something that's more dynamic, there we go. So see out of this individual, his legs are moving into it, his arms are moving into it, he's completely across his body. Right. So that's a higher end dynamic rotational exercise. So usually like every athlete, especially like baseball players, track and field athletes, um, I've never seen a baseball program not have some kind of chop like this in there. And I remember like when we were training throwers in college, all like this. Huge power exercise, right? Because now we're starting to actually work those muscles, those core muscles in a way that's functional, right? If you're throwing a baseball, if you're throwing a discus or a javelin or hitting a ball with a bat, you need to be able to generate force from the ground, stabilize the midsection like we were talking about with the core, and then distribute that force through the upper extremity to either release an implement or strike an implement, right? An object. So then we're talking about being more dynamic. Crawling patterns, again, this is now just trying to move. Let's see where we're at. We were talking about this with pushing exercises too, right? But can the spine stay? Or now, so in this one that we're actually moving, we can actually move and articulate all the limbs and our spine's ability to kind of control that as we're moving, right? Because again, the goal here is just, can we keep a decently stable core like a spine while all these muscles are moving around it? And med ball throws, let's see which ones I put in here. Truthfully, there's so many different rotational med ball exercises. The cool thing with kind of med ball exercises, you can have it mimic a very an athletic movement. Oh, here we go. Yeah. So if we have somebody that's like a javelin thrower, right, and they're going to hop into it, they're going to crow hop, right? So then we can take the ball and we're doing lateral locomotion into the throw. So really with med ball throws, they're great for core exercises, especially on the dynamic level, because now we can take something and make it open chain and we can make it very sport specific. So that's kind of like med ball exercises are almost limitless, but they are on the higher dynamic range. So if you have anybody that has like spinal flexion or extension issues, you're probably going to wait and do some of the advanced isometrics and basic isometrics first, and then you can have some fun with these exercises. And yeah, and that's pretty much it, because then now we have the functional line, lateral line, posterior, and anterior.